I look around and I see people giving voice to the voiceless. I look around and I see people committed passionately to the work of justice, the work of peace. And I am so honored and privileged to stand in solidarity with you here today, to be part of this movement of bringing change that can save lives. My name is Pastor Khader El-Yateem. I serve as a pastor of the Evangelical Lutheran Church in America in the capacity of the Executive Director of the Service and Justice Unit. This unit encompasses the World Hunger, Lutheran Disaster Response, and our advocacy work. And this is a critical time for us to rise up together to respond to the need of our neighbor as we continue to live our faith in action. So thank you for showing up here today to live your faith in action, to care for the most vulnerable among us, those whom Jesus have called us to love and to care for, the poor and the marginalized. The ELCA practices what we call accompaniment model, which means that we work together in solidarity with the global companions, striving to share God's love and participate in God's mission together. The stop work orders and funding freezes are impacting our partners implementing global health programs, such as combating malaria, tuberculosis around the world. These programs can be reviewed for efficiencies without abruptly interrupting them. President Trump's abrupt suspension of U.S. foreign assistance and cancellation of these programs, for which Congress had already appropriated funds, has shattered the global health architecture, cutting access to health care for vulnerable children, mothers, and families, putting their lives at risk. One of the programs impacted by this foreign aid freeze is PEPFAR, the U.S. President's emergency plan for AIDS relief, a program that until now has enjoyed broad bipartisan support. Launched in 2003 by President George W. Bush, PEPFAR provides antiretroviral medicine to millions of people living with HIV, including children, helping them to live healthy, long lives. PEPFAR provides medicine to pregnant women to prevent transition of the HIV virus from mothers to babies. PEPFAR supports prevention services to reduce new HIV infections. By many measures, PEPFAR has been the most effective, successful U.S. government's global health program, credited with saving 25 million lives and preventing millions of new HIV infections. Freezing PEPFAR is interrupting treatment, exacerbating drug resistance. Our siblings, especially children, will suffer and die unnecessarily unless Congress acts now. A colleague serving in East Africa sent me this update last week after a visit to a local health center supported by the church and USAID. Dowdy writes, outside the clinic, under the tent, youth who are part of a livelihoods program run by the Lutheran Church showed their skills at making and processing things like honey, jam, beaded goods, and other items to help them make a living. Many were children and adolescents living with HIV or children of people with HIV/AIDS. Others from the same project are young people who learn strategies to avoid HIV infection. Young people living with HIV/AIDS who get life-saving treatment, counseling, and nutrition. People exposed to gender-based violence who get responsive intervention, clinic patients who get free HIV testing, and pregnant women who receive drugs to prevent mother-to-child transmission of HIV. Nearly, he says, nearly all staff were sent home yesterday indefinitely, but on unpaid leave. The project is one of the many casualties of President Trump's freeze of nearly all foreign aid. Other American-funded aid projects in East Africa fund soup kitchens in the depths of Sudan's civil war and fighting outbreaks of horrific diseases like Ebola. Globally, American aid work is far-reaching, as is the aid freeze. This is beyond politics. It is about cruelty. Cruelty might not be a concern of those who designed the aid freeze, but even in terms of cold strategies, it is counterproductive. It is easy to guess what happens when they cut off funds to programs that give youth reason to have hope that they can find economic justice, peace, health, food, and voice in their own home countries. Reasons not to migrate and leave their communities and culture. To my Lutheran friends in the United States, be proud to be part of a church that does this in the world, even if your government, to the detriment of its own goals, has chosen to stop. In St. Paul's letter to the Corinthians we read, if one member of the body suffers, all suffers together with it. Our siblings are suffering and we hurt too. Our siblings are suffering and they ask for our action. Our voices and our bold witness ring out today to speak faithfully and persistently to Congress to stand firm against executive actions, the suffering they are causing, and to speak up to the continuation of PEPFAR and reinstatement of all life-saving humanitarian development assistance. Again, you give me hope, because you are standing together as faith actors to speak truth to power, to reinstate the life-saving lifelines to many communities around the world. Our words and our actions, our activism matters to our siblings in Christ, our siblings in faith, our siblings in humanity all over the world. And I stand in solidarity with you, and I say thank you for showing up here today, for raising your voice and your hearts and working for justice, peace, for the sake of equality and providing help and healing for all. Thank you.